Hello, my name is Peter Furton. I'm a Kennebec Valley Community College physical therapist assistant student, and my evidence-based project for my second clinical was operative treatment versus non-operative treatment of the Achilles tendon rupture. And I chose this topic because we had a patient come in with COPD, and it turned out that he also had an Achilles tendon rupture. And it was missed on the first when he first came in because that's not why he was there, and it became a point of interest that we kind of looked into in the physical therapist department. So some background is the Achilles tendon is the largest tendon in your body. It stretches from the bones of your heel to your calf muscles, and it's a common injury most often in adult males in their 40s and 50s, and it's a 10-to-1, male to female. You can also usually walk after you've ruptured your tendon. So here I've added a picture of an x-ray on the left and an MRI on the right. So if you look at the x-ray, you can really see that the Achilles tendon rupture isn't all that evident on x-rays. And that was one thing with our patient at the clinic, is he did have an x-ray that we looked at and we couldn't see anything. So I was kind of curious about why it didn't show up there. And it turns out they just don't show up well on an x-ray. But you can see that there's a very distinct rupture on the MRI. So if your Achilles tendon tears, you may hear a snapping or popping noise when it happens. And there could be bruising and swelling as well. So you'd have trouble pointing your toes and pushing off on your toes when you take a step. And 20% of ruptures are missed on the first examination. So that was an interesting point. Usually they use what they call the Thompson's test, where you squeeze the calf, and that should make your foot plantar flex. And it was unclear. I did ask the physical therapist I was presenting this to if that was common to miss that. And they weren't they didn't use that all that often. They hadn't seen a lot of Achilles tendons ruptures. So it was unclear if that was really a good test or not. But 20% is a pretty large percentage to be missed. This is just a picture of an Achilles tendon where it's located, and you can see a little bit of the rupture. So my first journal that I looked at was operative treatment versus non-operative treatment of the Achilles tendon, systematic review, and meta-analysis. So 29 studies, including 10 randomized and 19 observational. The results: significant number of re-rupture in non-surgical, but no significant re-rupture in treatment that was used functional rehabilitation and early range of motion. And that was an important point that came out of this study, and I will mention it later as well. So surgical had a lower number, not a significant number of re-ruptures, but they did have a larger number of surgical complications. So in our case, the patient that we had COPD, so he wasn't going to be a very good candidate for surgery. And he also had cellulitis. So you really probably didn't want to risk infection by opening up the leg that had that. So the conclusion of this study was that treatment should be based patient to patient.